Good afternoon, everyone. Thank you for joining us. Today, we are joined by our colleagues with the Oklahoma Water Resources Center with the Oklahoma Well Owner Network. Dr. Jeff Sadler will be doing the presentation today, and we have collaborated with their group for, I want to say, a couple of years now. They did participate and exhibited at the Rural Health Conference last fall. And while meeting with them, learning about the resources that they have available in rural communities has been really great because I know water quality and, in particular, testing of what personal well water has been a topic that has come up through our community health needs assessments. And I know as we're moving forward with social determinants of health and um, creating a resource list for our screen positives for our social determinants of health. This is a great resource to add kind of to that list. So we are a small group today. If you have any questions at all, please feel free to unmute your line or put something in the chat. I will be managing the chat. So with that said, Dr. Sadler, I'll turn it over to you.
Thank you, Laura. I'm glad to be with you all. I'm an assistant professor and state water resources extension specialist in the Department of Biosystems and Ag Engineering. And I'm happy to present on behalf of our team. I just wanted to read out their names since they've been a big part of this project. Kevin Wagner, he's the director of the Oklahoma Water Resources Center. Nicole Colston is a research associate with the Oklahoma Water Resources Center. Brianna Barker has been doing a lot of our media and advertisements and publicity for this program. And then we have several students who have been helping with the project, going out to events and doing the actual testing. Jim Pendred, James Lee, who's an undergraduate, Kaylin Hall, Brody Buer, and Erica Pretorius. And I just wanted to acknowledge their contributions to all this. So I'm starting with the takeaways. So as long as I have your attention for the first minute or two, I'm hoping that you can, if you don't remember anything else, you can remember these 3 points. The first one is that private well owners are solely responsible to ensure their drinking water is safe. The second is that well owners should get their well tested for bacteria and nitrates at least every year, and for other contaminants at least once. And I'll go through those contaminants. And then the third is that well owners can get their well tested through the OSU extension, the OSU Oklahoma Well Owners Network, of the events that we put on, the Oklahoma Department of Environmental Quality, their lab, or other certified labs. And not all of those test for the same things, and so I'll go into details, but those are the 3 main things. So they're solely responsible for it. They should get it tested on a regular basis, and the way to get it tested is through these resources, and I'll go to details about each one of those. So, as Laura said at the beginning of this presentation, this is a major concern among a lot of people, residents themselves and healthcare providers. To uh, to kind of make this a little bit more specific, when the Oklahoma Water Resources Center sent out a survey recently to determine what people are concerned about, their drinking water quality was at the very top of the concerns that came out of that survey. And this is particularly important for private well owners. The Safe Drinking Water Act, so that's a law that's implemented, that's administered through the EPA, and the EPA usually administers that through state agencies. In the case of Oklahoma, it's the Oklahoma Department of Environmental Quality. So that's a lot, but basically the gist of it is the ODEQ protects the quality of public drinking water in the state. So if you're on a rural water district, if you're on rural water, if you're on city water somewhere, then the DEQ has regulations so that those water providers are required to monitor and report the safety of that drinking water. Now, if you are on a private well, that is not the case. So there's no government program for monitoring or protecting private wells. Private well owners are essentially on their own for ensuring their well water is safe. And in Oklahoma, we have around 35,000 private wells that are used for domestic water consumption. So there are a lot of people in the state, and especially as you get away from the major metro areas um, or any kind of larger city, those rural those people living in those rural areas a lot of times are on private wells, and so what we're trying to do in this program is to provide for them resources for them to ensure that their water is safe. From a health perspective, I wanted to talk about two different standards that the EPA sets, and these are ways to measure the safety of drinking water. So if you're a private well owner, you need to know what you're looking for, what counts as safe and what doesn't count as safe. And the EPA sets standards so that we can judge our water and the safety of it. There are two different types of standards. One is primary drinking water standards, and the second is secondary drinking water standards. So the primary drinking water standards, those are for contaminants that will affect human health. And the secondary drinking water standards are for constituents in the water that are mainly affecting the aesthetics of the water, so taste, the, the color, or the smell of the water. Now, there's a lot of standards that the EPA sets, but and you can spend thousands of dollars testing for all the different things that could be in your water. Um, that's not reasonable for most all well owners. So we recommend that well owners focus on a select number of contaminants or issues to focus on and as a first cut in their testing. Those are bacteria, so total coliforms and E. coli, nitrates, arsenic, lead. Those are the primary drinking water standards. And the secondary drinking water standards are sulfates, the pH of the water, and then the salt content, which we measure as total dissolved solids. So um, the EPA has set a maximum contaminant level for each of these standards. And I'll just walk through each of those. For total coliforms and E. coli, the standard is that they're totally absent from the water. So any total coliforms or any E. coli is outside of that standard. And I think that's for pretty obvious reasons that if you have E. coli or those total coliforms, then you're at a high risk to have acute symptoms that are going to affect your uh, your health right away. So you could have diarrhea or stomach cramping or those kind of GI symptoms. The nitrate standard is 10 milligrams per liter. Now, nitrate is mostly going to affect infants and pregnant women, and it doesn't actually affect the women, but the fetus. And so this is particularly important if there is a pregnant woman or an infant in the home. The same, although arsenic and lead, I think everyone knows the those are heavy metals that can naturally occur in groundwater or I s- I what I mean I guess what I'm trying to say is arsenic can naturally occur in groundwater, but lead that usually is coming from any kind of lead fixtures in the home, either pipes or other plumbing fixtures that can leach into the water. And those also affect children more. So when we talk about testing and making sure that your water's safe, it's particularly important if there are children in the home because those contaminants can affect the children more. Um, and then the secondary drinking water standards, sulfates is quite a bit higher, so 250 milligrams per liter. And then pH, there's a range between 6.5 and 8.5. But again, if you're outside of that range, it's not necessarily a primary health concern. Rather, it's a secondary aesthetic concern. And the same goes for salts in the water. And that's again measured in total dissolved solids, which is basically measuring the conductivity of that water. Now, how often should well owners get their water tested for these different constituents or contaminants? For total coliform, so the bacteria in E. coli, and then for nitrates, it's recommended that those be tested annually. And the same for pH. So pH is quite an easy test to run, but it can, with changes in pH, it can affect or corrode your pipes or water fixtures in your house, and so that's a good one to have done annually. I'll also mention that total coliforms and E. coli and then also nitrates can change quite frequently based on climate events. So, for example, if there's a flood in the area that where the wells are submerged, the wellheads are submerged, then surface water will get down into the well and can bring in bacteria into the well. And so it's particularly important if you have a flooding event that you get your water tested for bacteria after that. Um, the nitrates, it's a dissolved inorganic compound, and so flooding won't affect that as much, but you can see increases in nitrates when there's prolonged drought, for example, because there's those uh, compounds get concentrated in the well. For arsenic and lead, it's important that you at least get your well tested once. Those things don't tend to change very much. And so it's usually sufficient to just get those tested one time to make sure that you don't have those issues. And then sulfates and salts, you can get those tested as needed. Sulfates can be a problem if the sulfate content gets very large. It can have a laxative effect. And then salts is more of a again an aesthetic parameter that you need to check. So if you have too high of salts or too high of TDS, those can precipitate and um, can start to uh, leave residue on your plumbing fixtures, and so that can be an issue from a maintenance point of view. Okay, and I mentioned this already that you need to test for bacteria if there's any kind of flooding event in your area. And in nitrates, for the nitrates, if someone in the home becomes pregnant, or if there's an infant that is living in the home that, uh, for example, moves into the home, it's important to have the nitrates tested to make sure that the level is below that 10 milligrams per liter to ensure that the those infants or the fetus will be safe. Now, where can you get the well water tested? There's four main places that I'm going to talk about today. So the first is the ODQ laboratory. That's in Oklahoma City. There are also ODEQ certified labs where you can take your water. And there's the Oklahoma State University's Soil, Water, and Forage Laboratory, or SWAFL for short. And finally, I'll mention some things about the events that we put on throughout the state. So the ODEQ laboratory, they are a certified laboratory. So the results that are coming out of that lab are certified results. That makes as a certified laboratory, they have certain accuracy standards and quality control and quality assurance. And because of that extra work that this lab has to do, it's more expensive to get those results. But if you need a certified test, then that's where you would go. And um, they perform a lot of different tests. If you look at their page for what they offer, it's a PDF that's, I think, 8 or 10 pages long of a table listing all the different constituents that you can get tested there. So it's very comprehensive. Um, you, you'd be paying a lot of money if you wanted to test everything, but they do provide the tests that are of main importance for well owners, and they are certified. And you can go to their website for more information about that. The ODQ also maintains a list of certified laboratories throughout the state. These are these laboratories have similar characteristics or similar, I guess, strengths or pros as the ODQ lab that it runs itself. So they can run a lot of different tests. They're going to be a little bit more expensive than a non-certified or informational product, and but they do have that certification that has the quality assurance. So uh, if you go to the ODQ website, and I don't think I wrote it down here, so I'll have to maybe send that to Laura and she can put it hopefully in some notes. Um, but it's if you just search ODQ lab, you'd find it on a Google search. Um, but they have a little search page where you can I'm just gonna use my laser pointer here. You can put in the state, obviously, which would be Oklahoma, but then you can put in your county and your city and your zip code, or just your zip code and look for a certain um, within a certain radius from your zip code. And that will bring up any certified labs within that area. Okay, and then there is the OSU's SWAFL. So they run a fewer number of tests, and by that I mean you can't get your water tested for as many things. Um, it's a non-certified laboratory, so it's just informational. It's an informational product that can be used by private well owners. And because it's informational, it's non-certified, it's typically, well, not typically, it is less expensive than the certified results. And this is usually, not usually, this is always done through the OSU extension, the county extension offices. So if you're in Ada, for example, you would go to the Pontotoc County Extension office and you would ask them for a sample bottle, and they would give you a sample bottle and some instructions for sampling, and you would go and sample and then bring it back, and they would mail it in to the lab here. So you have to work through that office to do those, but they're used to getting these requests, and so they have a whole system for doing that. Those are about, the last time I looked, they were $18 for a household water test. And then finally, the events that we put on. So the Oklahoma Well Owners Network, we put on events throughout the state, um, where we go and provide education, and then we also provide the opportunity for people to bring in a sample from their well. And we will take those back here to our lab and test those and send out their results. We run a relatively few number of, we test for a relatively few number of constituents. So that's something to consider. Because this is funded through grants and with the support of some other internal funding, it currently is free of charge. We're able to offer at no cost to the well owners. And these again are at scheduled events, so it's not an on-demand service that we can provide. I made this table just to kind of illustrate the difference between the different services. So here in the first column, I've put the ODQ and the ODQ certified labs together, and they can test pretty much anything you need tested, but it is going to cost a little bit more money, and um, but you will have that certified result. The SWAFL, they will not test for the bacteria, and they do not test for the heavy metals. And both the heavy metals, they require a bit more specialized equipment, and then the bacteria, they require that the samples be collected and processed within a certain time window, usually about 24 hours. And since these samples are sent in through the mail, they can't guarantee you that time window is going to be respected, and so they don't test for the bacteria. But they do test for nitrates, and they do test for sulfates and pH and the TDS. And they will test for quite a few other inorganic compounds um, that can be helpful in understanding your well water. And then for the OSU events, oh, and like I mentioned earlier, the SWAFL's less expensive than the certified labs, and these are on demand. So anytime you need to, you can go into your county extension office, or the people you work with can go in their county extension offices and get a sample bottle and get that sent in. And then the ones that we run, we do test for bacteria since we're able to bring back the samples right after the events and get those processed. And we test for nitrates. We're planning to include arsenic tests, but it also is dependent on the location of the event. So some areas naturally have higher arsenics in their the groundwater, and so um, we'll we plan to offer that to certain areas of the state when we go out. We don't currently have plans to include lead since that requires some special equipment that we don't have. Um, and we do plan to incorporate sulfates in coming events as well. We test for pH and the TDS of the water currently. Right. Now, I just wanted to talk a little bit more about the events that we put on, just since might be helpful context for when you are talking to rural folks in your uh, areas about well water and what we might be able to do to help them. So the way it works is that we schedule a time, usually with a county extension educator or another local community member, and the well owners will collect samples and bring them to the extension office or whatever local venue we're at. And we test those samples for those contaminants that I listed before. And then we also provide the results and some educational resources and recommended actions for the well owners based on the results of their uh, well sample and the test. So um, here's just a little example of one of those events where folks, well owners, came in, and then we presented a PowerPoint presentation the about what we were providing and about uh, some basics of well water maintenance and well water testing and how they can maintain safe well water. Um, I think there was something I was gonna say, but I've forgotten, so I'll move along. Um, Now we are coordinating with the local organization when we do these things, these events. So we provide the marketing materials and the publicity, and Brianna Barker is actually on the call here, and she's the one that is responsible for those materials and does a really good job with those. So we're thankful to have her on the team. Um, and then we obviously come to the event and receive the water samples, and then we provide an educational um, either presentation or some materials that they can take home with them. And the local organizations, they promote the event and they'll distribute the flyers or put on their Facebook page, that kind of thing. And then answer questions leading up to the event and set up the venue. And then obviously be there to help kind of triage people and direct traffic, if you will, once they get there. Um, we, like I mentioned before, a lot of times we work with county extension educators. They seem to be quite uh, well connected with the rural communities and are able to get the word out effectively to the well owners. And so at some of these events, we've had 60, 70 people that have shown up to get their well tested and to learn more about the program. And so um, those are obviously numbers that we could never do on our own. So it's been a good partnership to have those people locally to communicate to the people that they actually know. We have also done some work at county and health fairs where we just have a booth and people can drop off their water. So here's an example. This is down in Jackson County at their county fair where where people coming into the fair could just bring in a sample and we would receive that sample and then do the testing. And then we've also worked with Blue Thumb. So Blue Thumb, in the cases that we've done it, they've tested the inorganic compounds like nitrates, and then we've tested the bacteria. And so that's been a good partnership as well. And a partnership that we're fostering is with local libraries as well. So um, the idea is that they're also a kind of a hub for the community. And so we're able to partner with them and provide these educational materials. And then hopefully they'll be able to provide, uh, get the word out and have a venue where people can learn more about well water and how to get it tested, how to see what your well water quality is, and then also how to maintain the a good quality well water. Um, the main part of this project started last August, and since then, so in the past year or so, we've been able to, and this is actually a little outdated. We have a little higher numbers since this was made, but we've been able to do 22 events throughout the state, and then collect. Now the number is over 500 samples that we've tested. So, um, one of the things that we've learned is that a lot of the higher nitrates are in the west of the state, and the higher TDS, so the salts, are more in the west. And we've, as a general rule, we've had more interest in well getting their wells tested in the west. I believe there's also more wells. It's a more important part of the it's a more important water source in the west, so it makes sense that they'd have more interest in getting their well water tested. Um, and in the east, we just haven't had as many people. We've had a roughly similar amount of events, but just not as many people come. And so far, the standalone events where we kind of have a 1 hour where they can have a presentation and and they're coming there just to get their well water tested have worked a little better than having them kind of partnering with the fairs. So I think with the fairs, unless they are really reminded a lot of times, they probably won't remember that they need to bring their well water sample to the fair. I would guess they have a lot of other things that they don't fair for, and so having the water as part of it, we haven't had as big of numbers as we initially thought. And so um, we might not be doing that as much, but it kind of depends on what the counties want and what they think will be most effective for them. So let me just end with the takeaways that I began with. That is that private well owners are solely responsible to ensure their drinking water is safe. There's no government agency, federal or state, that is that is monitoring or ensuring that their well water is safe. It's up to them. Um, those well owners should get their well tested for bacteria and nitrates at least once a year, and for other contaminants like arsenic and lead at least once, so they know if they have a problem that they need to address. And then finally, to get those tests done, there's several options where they can do that. Whether that's through OSU Extension, an event that we are putting on, the ODQ lab, or another certified lab. There are several options for them to get those tests done, and each has their own kind of strengths and weaknesses, but there's but those are available to them. And with that, I thank you all for the time and um, appreciate this opportunity.
Are there any questions while we have Dr. Sadler on the line? I do have a question. Most of our audience on this call today, as well as our audience for our YouTube channel, are largely rural hospitals as well as rural health clinics. And you mentioned hosting events, and you've had standalone events do well, especially, and also you've had one that was part of a health fair. If some of our hospitals or clinics would like to host an event, how do they go about getting that ball rolling? Should they go through their county extension office, or should they reach out directly to you or your colleagues?
Um, I think either would be fine. The word eventually needs to get up to us. So if they reach out to their county extension person, that county extension person might need to reach out to us. So it'd probably be more efficient just to email myself or someone else on the team.
Okay, that sounds great. Uh, are there any other questions? All right, well, if you get off the call today and have a question, please feel free to reach out to me. Or if you're watching this recording and have a question, please reach out to me. I'll be happy to put you in touch with Dr. Sadler and his team.
Can I ask a question?
Absolutely.
The audience, it's a little bit hard to present to, but anyway, I hope it was useful. But my question is, if y'all are working at rural hospitals, is this something that comes up? Are people concerned about this? Are you concerned about this? And I'm just curious about what the what the what the conversation is out in the rural health communities.
JP, Pam, and Tamara, I would defer to you guys. What are you hearing?
Well, we've got a lake close by that we get a water source. But this is more for my home use because we are rural. So most of my team members here have the rural water system and they're privately owned. So I'll share this with them.
Yeah, and then Pam mentioned that she thinks it'd be great to, Pamela Lovelace mentioned, be great to host an event at their facility as well. Well, I can link you guys up after the call. But if there are any questions that come up, please don't hesitate to reach out. And thank you guys. Thank you, Dr. Sadler and Nicole, for your time today.
Thank you. Appreciate the opportunity.